Hey guys, hello and welcome to our YouTube channel. So in this video, we are going to take on another class of diuretics which are called as carbonic anhydrase inhibitors, and the prototype drug in this class of diuretics is the acetazolamide. Although there are some other drugs like dorzolamide, but in this scenario, in this video, we'll take on only the acetazolamide and its mechanism of actions, the clinical scenarios in which we use acetazolamide as a diuretic, and also the potential side effects of acetazolamide. So guys, the site of action of acetazolamide is the proximal convoluted tubule, but before we really take on the mechanism of action, let's look at the basic physiology which is going inside the proximal convoluted tubule. So we will start from here. As the carbonic acid it enters into the proximal convoluted tubule, the enzyme called as the carbonic anhydrase enzyme, it acts on the carbonic acid and it splits the carbonic acid into H positive ions and bicarbonate ions. Now the bicarbonate ions which are formed, they will exit the cell via its basolateral side, and as a result of this they will be absorbed into the blood circulation. While the H positive ion which is produced, it will go and it will get binded to a transport protein which transports it from the intracellular to the luminal side, and while the H positive ion is transported from the cell to the luminal side, on the same line the sodium ions which were in the lumen, they will be transported back into the cell, and as the sodium it gets transported back into the cell, it will go on to the basolateral side where there is a pump that will pump all the sodium out into the basolateral membrane and the basolateral side of the cell, and via which it will be absorbed back into the circulation. So mainly two things, that is the sodium ion and the bicarbonate ion, they are really reabsorbed into the circulation while the H positive ion is thrown out into the cell. Now as the H positive ion is thrown out of the cell into the luminal side, it will bind with the bicarbonate ions and it will result in the formation of carbonic acid. Again, the carbonic acid will be splitted by another carbonic anhydrase, but this carbonic anhydrase, since it is present outside the cell, it is called as extracellular carbonic anhydrase, and it will break down the acid into water and CO2, which will again bind in a fraction of a second within the cell to form carbonic acid, and hence the cycle repeats itself. But guys, what is important to know over here is that during this cycle only the bicarbonate ion is reabsorbed and the sodium is reabsorbed, but the H positive ions, there is no net loss of the H positive ions. See, the H positive ion which was produced over here will again transport via this pump, and it will again bind with the bicarbonate ion and ultimately will land up inside the cell again, and it will complete the cycle, but it will never be lost in this cycle. What happens only is that there is the reabsorption of bicarbonate ion. Okay, now let's look on the mechanism of action of acetazolamide and how will it act as a diuretic. Now the acetazolamide will act and it will block the carbonic anhydrase. As a result of the blockade of the carbonic anhydrase, there will be no production of H positive ions, and since H positive ion is not produced and neither the bicarbonate ions are produced, this H positive will not move towards this pump, and as a result of this H positive ion will never be transported into the luminal side, and since H positive is not transported into the luminal side, therefore the sodium will not be reabsorbed from the luminal side. Therefore neither the sodium is reabsorbed from the luminal side, neither the bicarbonate ions, they are reabsorbed from the luminal side. So sodium will stay in the lumen and bicarbonate will stay in the lumen and they will be excreted. and as sodium and bicarbonate ions they are excreted, water will also follow these ions, and therefore this will result in diuresis and the action of the drug. So this is the whole idea behind the functioning of acetazolamide, that is only the inhibition of carbonic anhydrase, as a result of which all the downstream reactions they do not occur, which results in the buildup of sodium and bicarbonate ions in the lumen, and as a result of which they will be excreted out, and the water will follow these ions and water will also be excreted out. So next we'll look at what are the clinical scenarios in which we use acetazolamide as a diuretic. Clinical conditions in which we use acetazolamide as a diuretic are glaucoma. See guys, you might be thinking that what is the relationship of acetazolamide to be used in eye. So again, in case of glaucoma, as I already said in my previous video, there is a rise in the intraocular pressure, and this rise in intraocular pressure is due to increased production of aqueous humor, and increased production of aqueous humor is due to the same pump that pumps H positive ion outside and sodium ion inside. So as a result of the inhibition of carbonic anhydrase via the acetazolamide, this pump will not function, and as a result of this the aqueous humor will not be increased and the intraocular pressure will not be increased. So therefore the acetazolamide is used in glaucoma. The second clinical condition is the acute mountain sickness. Guys, I will make a separate video on acute mountain sickness, but for this moment just remember that in case of acute mountain sickness there is an increase in the bicarbonate ions within the body because of the respiratory alkalosis, and now since the acetazolamide it decreases the reabsorption of bicarbonate and it causes the bicarbonate ion to be excreted out, so therefore it is used in case of acute mountain sickness. The third clinical scenario is metabolic alkalosis. See again, in case of metabolic alkalosis there is a rise in the bicarbonate ions within the body which lead to an increased pH within the body. So as a result of this, when we administer the acetazolamide, it will cause the excretion of the bicarbonate ions, and therefore it will bring the bicarbonate ions back to normal, and hence it is used in the treatment of metabolic alkalosis. Now let's look at the potential side effects of acetazolamide. The potential side effects of acetazolamide is bicarbonate urea, that is the loss of bicarbonate in the urine, and acidosis. See guys, as there is a lack of bicarbonate or loss of bicarbonate, it will lead to the increased H positive ions because they are not being neutralized. So it would, if the loss of bicarbonate is more, it will lead to acidosis. The second complication is the renal stones. See guys, whenever there occurs an increased pH within the urine, which is actually happening due to increased bicarbonate loss, it would increase the rate or the risk of stone formations. Third complication is hypokalemia, or the third side effect is hypokalemia. I will explain why hypokalemia occurs with the use of diuretics in my subsequent videos. The next side effect is sulfonamide hypersensitivity. So sulfonamide hypersensitivity is a phenomena which occurs whenever we administer drug to the patients who are genetically susceptible, and these drugs should have a sulfur within them. So whenever the sulfur containing drugs are administered to some patients, they may develop a hypersensitivity phenomena which is called as sulfonamide hypersensitivity. Then next we have paresthesias. Paresthesias are basically the tingling sensations or the cutaneous sensations which are observed in certain patients, and this may be because of alteration in the pH, and it may occur because of decreased pH within the body as a result of the use of the diuretic. So I hope I make the video clearer and more simpler to you, although it took more time for me. Guys, please subscribe to my YouTube channel for more videos like this.